In case we haven't met, I'm Dr. Marion Long and I'm the founder of the Rhythm for Reading Intervention Programme. In my career in educational research and as a practitioner researcher in schools, and also at the sharp end of academic support in a leading independent school, I've worked with many children and young people with neurodiverse and specific learning differences. It's clear to me that the effective aspects of neurodiversity and specific educational needs really do overlap with mental health issues. For example, children and young people may express or repress chronic or acute levels of frustration and anger when they're unable to move forwards in their education or just simply make themselves understood. Over time, their self-esteem and engagement with learning can drop away, which thus not only impact their educational outcomes, but also their social development and sense of belonging. In a sense, digital technologies have been hugely helpful. Tech companies have worked really hard to make their platforms responsive, inclusive, and accessible. And many people using these modifications that are available now have really benefited. But in the day-to-day life in schools, teachers may not feel comfortable with their students advocating for themselves using a range of technological workarounds because the online world is regarded as an unregulated space. This complex topic is not helped by educational research. Findings from medium to large data sets provide mixed messaging and contradictions. And this is because, in my opinion, aggregating information from different contexts with the aim of detecting irrefutable patterns is somewhat reductive and a little bit idealistic. What we really need are rich narratives that shine a light on the lived experiences of children, their families, and communities right across society. Let's begin with the broad and balanced UNESCO report that compares the potential harms with the potential benefits of digital technology. It's called Screen Time and Learner Wellbeing, the Debate, the Evidence and the Directions for Future Research and Policy by Professor Robin Sharma and colleagues. There are positive and negative effects of using digital media, and many people feel that the harms are overstated by policymakers and paediatricians. I agree that it's important not to oversimplify or overgeneralize the debate around screen time. And yes, the debate must be balanced. But for individual young people and their families who face tragic consequences of unchecked exposure to the internet, it's important that we discuss this topic with sensitivity. The UNESCO report sets out 4 different approaches to exploring the topic, and I think these are really helpful. First of all, there's the displacement hypothesis. And this view sort of looks at screen time as a way of displacing other activities such as face-to-face socializing, exercising, and even sleeping. So, in other words, this is a real look through the lens of the harmful effects of technology. Secondly, there's the rich get richer hypothesis. This is also known as the Matthew effect. It's very familiar to the education sector, based on the child's access to privileges, including social networks, social skills, that sort of thing. This hypothesis states that those advantages will help them when they're using technology. The third approach, the social compensation hypothesis, states that if you're a socially anxious or socially isolated child or young person, online interactions may actually really help you because they allow you to overcome the difficulties that you might be experiencing with face-to-face interactions. The stimulation hypothesis is the fourth and final one. Here we consider digital interactions that can enhance communication with existing friends and benefit children's social development for that reason. So it's a little bit like saying if you've already got a lovely friendship group, then you can probably benefit from spending even more time with them. The scale of the UNESCO report is also very impressive because it draws on 22 research papers which involve a staggering 3.77 million people. But the scale of the report means that it is actually quite difficult to pin down even basic definitions. Notions such as excessive use, normal use, or moderate use of devices can really vary from one generation to another. So in this way, the situation is very fluid and it's difficult to compare perspectives. Here's a good example of the same kind of fluidity. The World Health Organization supported video games as a healthy means of physical distancing in the COVID-19 context. But at that same time, it also added gaming disorder as a classification alongside others related to addictive behaviors. UNICEF states that children can be disproportionately, severely, and permanently impacted by business activities, operations, and relationships, and as such, they merit special consideration and attention from businesses when they consider their human rights impacts. Vodafone have picked up the baton on this, and they have a very, very strong emphasis on parental guidance on their website and how to manage a child's use of mobile devices. They have guest experts who write posts for their blog in a very clear and helpful way. For example, one of these posts asks, how can parents make sure that the cult of the perfect selfie doesn't have a negative effect on their child's body image or mental health? According to the Mental Health Foundation, 37% of teens aged 13 to 19 felt upset, and 31% felt ashamed of their body image. And we know that bullies have always induced shame and guilt in their victims, particularly in teenage life. Cyberbullying takes the bullying online. It involves sending messages by mobile phone or over social media, or sharing images or personal information. And the effects of cyberbullying are particularly damaging for two reasons. Firstly, because young people have to be connected to the internet to complete their homework. So for this reason, cyberbullies can abuse their victims, not just at school, but also in their homes and even in their bedrooms. And secondly, the abuse or the harassment can be spread immediately and seen by a very much larger audience than if the bullying was taking place offline. And for these two reasons, the effects on the child victim are all the more traumatic and impactful. Another Vodafone expert, Dr. Richard Graham, who is the leading child and adolescent psychiatrist specializing in technology addiction, says that in his clinical work, young people and their families who use online activities find that they're interfering with school attendance, face-to-face social activities, and even their physical health. So in this respect, he's really echoing the displacement hypothesis in the UNESCO report. Dr. Richard compares internet addiction, for example, spending 14 hours a day online, with other behavioral addictions such as gambling. And what he says really echoes what I've heard from parents as a call taker in a national helpline. Many young people get very angry when their parents ask them to hand over their laptop or their phone or their console. And when the child has developed an addiction, these feelings are extremely intense. Parents face aggression and even violence on a daily basis if they try to remove the device from the child. Dr. Richard refers to withdrawal symptoms of going offline, and he recommends having something else to do, especially if it involves all of the child's senses and their body. But of course, at bedtime, that's unlikely to be the case. In my opinion, there's a really stark contrast between the diplomacy surrounding the debate around screen time and the lived experiences of individual families who are in crisis. When a teen is addicted to the internet, high levels of child-on-parent abuse affect not only the addicted child and the parents, but also the other children in the family. According to the Children's Commissioner for England, Dame Rachel de Souza's latest report, which was published in March 2024, the number of children waiting for appointments with Children and Young People's Mental Health Service, known as CAMHS, is at an unacceptably high level, with 270,000 children on the waiting list, and of those, 40,000 have been waiting for more than 2 years. There are insufficient resources available. Waiting lists are constantly growing because the number of children at risk of self-harm, suicide, or harming others is rising. So, for example, in 2017, NHS figures showed that 1 in 8 children had a mental health condition, and in 2023, this figure was estimated at 1 in 5. Of course, it's right that urgent cases are prioritised. And unfortunately, this means that the younger children, for example, those who've got suspected autism, might have to wait even longer for a diagnosis. And this places the schools, the teachers, the children, and the families under really intense pressure long term. The rising number of children at risk of self-harm illustrates the pain felt by this lost generation. And the 1 in 5 needing specialist care, and those younger children who cannot yet access education because they're having to wait, they too are lost. They're unable to develop properly until they receive the support that they need. So in the next post in this series, I'm going to be talking about the impact on engagement with learning for this lost generation of children. I hope to see you there. Bye for now.